Tonight, we've heard stories from across the region of how fentanyl has shaped our community.
And now we're going to bring in experts for a deeper conversation on its impact right here in our region.
Let me introduce our panel tonight. Jeff Noah from the Sullivan County Anti-Drug Coalition, Dr. Angela Hageman from the ETSU Addiction Science Center, and Dr. Keith White from Ballad Health. So let's go through and tell everybody what your day-to-day is and tell us a little bit about yourself.
I was 26 years in ministry as a pastor, suffered from addiction to alcohol. Basically gave that career away and ended up getting into recovery, and after a few years in recovery started wanting to help and make a difference. So I currently am the recovery team director or leader at Sullivan County Anti-Drug Coalition. I coordinate all of our intervention programs, and so if someone has experienced an overdose in the community or has landed in jail due to whatever involvement they had with the drugs or their charges, we try to connect them with peers on our staff who also have lived experience in addiction and recovery, and we're basically trying to get them all the resources that they need to kind of turn their life around, get it back on track, have the life that they really want to have, and just have a new life.
All right, Dr. Hageman?
Yeah, as co-director of the ETSU Addiction Science Center, I would say that the central focus of our work is to partner with community partners like Jeff and the Sullivan County Anti-Drug Coalition. So since 2012, I guess for 11 years I've been working here, since 2013, and just engaging with community partners on a regular basis to find out what the needs are, helping with grant writing. Our portfolio is I say about 60% NIH funded research on the studies of advanced recovery supports, and another part is just community education and outreach and working with our partners.
Dr. White?
I'm the Chief Medical Officer for the Behavioral Health Division at Ballad Health. And I wear a few different hats in that role. When I'm working clinically, I'm typically on the front lines, be it in an inpatient acute care psych facility, helping to detox people off of fentanyl, or helping to coordinate them in the emergency rooms to get treatment, into opioid-based outpatient treatment programming. When I'm wearing my administrative hat, I help to roll out programming to mitigate the impacts of fentanyl on our region.
Well, let's start with you with our first question, kind of the history of fentanyl in our area. Obviously, it's developed into a huge concern. That is why we are here. How did we get to this point in this area?
Well, it really started in the mid-90s when OxyContin had a lot of notoriety, a lot of advertising. The pharmaceutical companies were pushing it, and there were plenty of op-eds and industry articles saying, treat pain as the fifth vital sign. But I think we took that just to a little too extreme, and as that was realized, the pendulum has sort of swung back, and folks are no longer using legitimate pharmaceuticals. They've gone to the streets, and what is now readily abundant and high potency here in our region is fentanyl.
And Dr. Hageman, you've seen this.
Yes, I have, and I think as we began to witness the overdoses related to prescribed narcotics and sort of some of the ways that pharmaceutical companies were targeting our area. And then we didn't have the treatment beds available. We didn't have the resources available. So at the same time doctors were being told not to prescribe, there weren't treatment resources. And so patients were being fired and left to their own devices to sort of manage this wicked disease. And now I feel like we have a lot more resources, but we've been in this for 20 years or more. So it's taking a lot of resources to address the problem.
And Jeff, you say you're on the front lines of this issue.
Yes. The numbers that we've seen over the last several years at some point have spiked, but in recent time it seems to have decreased some, but that still is a staggering number of what we're talking about. And whether it's methamphetamines, cocaine, whatever the drug is, there seems to be a presence of fentanyl or some other impurity mixed into it to make it more potent, more economic for those drug dealers, I guess. but the socio-economical factors that people are struggling with is creating some kind of desire inside to run away from life, run away from reality. So they're self-medicating a lot. We see very few people that it's a party scene. That's a misconception. These are people that are struggling and beat down by life, and they're just trying to cope or check out and feel nothing. And because of that, you're seeing the numbers.
Right. Dr. Hageman, we've seen just in doing our research that this drug, this issue, does not discriminate at all. Are you seeing that where you are?
Yes, certainly. I think that the age characteristics change alongside the drug supply, if you will, and I think as pressed pills that look like any other medication have come onto the scene more recently, those illicit pressed pills that look like other medications, we're seeing higher numbers of teen deaths. We're seeing a lot of, campaigns saying one pill can kill, and that's the reality now. And I think back, say, 5, 10 years ago even, the access to these pills, pressed pills and different things were just different. So the access, the type of drugs that are accessible on the street do sometimes change that profile, but no one is safe, no age group, no ethnic group, no region of the country is safe right now.
You talk about 2 decades plus that we've been combating this. In that time, we have added resources. There's more visibility on the destructive nature of fentanyl. We'll start with you. Just describe the resources that we're putting towards this, whether it be financial or otherwise, and are we seeing a difference?
Yes, seeing a difference. A lot of our clients that were with us as recently as 4 or 5 years ago, now when we're attempting to work with them, are seeing opportunities that they said we didn't have this before. Just the mere fact that we're able to have not carte blanche, but access to facilities like jails, treatment centers, whatever, to be able to go in and to try to reach people where they are in that crisis or in that moment. The recovery housing community has exploded in this area just in the last 3 years. Other intensive outpatient programs that are increasing. The employers in our area, that whether it was a circumstance from COVID where they were having difficulties having any workers or all, are kind of loosening their requirements at first, and people that would have never had an opportunity for employment before are actually able to get a decent job, which is a big part of getting their life turned back around.
Dr. Hageman, you had mentioned it's more than money. It's a broad base of ways to approach this. Elaborate on that and how we can move forward and continue with more resources.
Yeah, I wish there was a single solution. I wish we could just wave a magic wand or do one policy or one thing. And I think Jeff spoke a lot about the recovery community. And I feel like people in recovery, certified peer recovery specialists, people in recovery are coming out and showing leadership in ways that we just haven't seen before. I believe that is going to be a critical ingredient to solving the problem. But everything from law enforcement, interdiction, focusing on the supply side of the problem in addition to making sure resources are available, and then prevention. I mean, really, if we can figure out how to prevent this from happening in the first place, programs in the schools, screening in primary care, there's just so many ways to address it early on so we don't end up putting out fires and having to use Narcan to save lives. But we've got a lot of work to do, and a lot of good things are happening in the past decade.
And Dr. White, what do you see when it comes to resources and enhanced ways to attack this issue?
Well, I completely agree. It's a multi-pronged approach. It's going to take a recovery ecosystem to tackle this big problem that we have. One thing that Ballot Health has done in the last year is we've started introducing medication-assisted treatment for folks with opioid use disorder in our emergency rooms as a way to get into the recovery ecosystem, and then we refer them to reputable partners in the community. The other thing that we've done with that is we have partnered with that program to distribute Narcan out of all of our emergency rooms at no cost to patients and their families if they have a risk. So.
Jeff, where would you like to see us move forward initially? Where is the next step financially or otherwise in combating fentanyl in our area?
Well, I think one of the greatest impacts in our area has come, as has been mentioned. People that are in recovery that are working with people who need recovery or who want recovery. So the certified peer recovery specialist, recovery coaches, someone to not give them a handout but a hand up and to walk with them. One of the biggest obstacles for people wanting to is they just don't know. What do I do? Where do I go? Who, am I doing this alone? Am I by myself? To have peers in this area, which are largely paid for from state funding or grant funding of some kind. So for us to invest in our community from whatever agencies are benefiting from it, and that's the entire community really. But once we've got such a good infrastructure in place with the detoxes and the treatment centers and the intensive outpatient treatment and the recovery housing, but to be able to get them connected, to find out where those resources are and someone to walk with them through that, that to me is going to be key.
Let's talk about just fentanyl as it is. Dr. Hageman, why do you think fentanyl has become as pervasive as it is here in our region?
Oh, in our region, it's really difficult to say. I think if you looked at a map, a heat map of where overprescribing occurred back as early as 2003, Central Appalachia was one of the few places in the nation that had contiguous counties having those high rates of prescribing. And so we have that demand. And so I think in many ways your fentanyl dealers, your cartels, whomever is bringing that access is targeting an area that already had the demand in place. So I think that that's unique. Certain areas, there are high intensity drug trafficking areas, places where interstates cross, places where easy access can happen. But I think it is more about the early days of the opioid crisis that started it here.
Well, unlike its predecessor, which was heroin, it's much more potent and it can be packaged in much smaller quantities to get the same effect as, say, heroin, 10, 20 years ago. And so it's easier to make it across the border and to be pressed into pills that look and might be exactly identical to legitimate pharmaceuticals.
As a parent, talking to my children who are teenagers, it's important to have that conversation, don't you think, Dr. White, with children about not just pills, but maybe just everything? What is your
absolutely.
opinion?
If it's not prescribed by a doctor, you haven't picked it up from a pharmacy, there's no way to know what you're actually using. And that goes with these vape juices, which are largely unregulated and have different quality standards than some other types of tobacco products. And so I would just say, be blunt, be frank with your kids. If you didn't get this from a doctor or from a pharmacy, then you shouldn't be taking it.
Well, we want to thank each and every one of you for sharing your time and expertise as we continue as a community to shed light on this crisis. And I just want to thank you all very much for taking time for us. If you want to see more from our panelists, you can do so on our website, WJHL.com.
One tool has proved to be the most useful when tackling the issue of fentanyl overdoses. The one thing healthcare leaders say you need to know and keep with you at all times.